this going. Then we're going to go ahead and Shae is going to, ASCC student body president, is going to go ahead and visit with us just a little bit. Eric Rose is then going to give us an update on testing. And then we'll be open for Q&A. So just to give you a sense of who on the administrative and staff side is on the phone call to help answer questions.
Shadow?
Yeah.
Oh, one thing, I believe we were going to record this, so I just wanted to make sure.
Yep, we're recording. Yep.
We are, okay. And everybody knows that, so good. Good.
Yep, yeah, and that's actually a good reminder though, that I should make the announcement. We are recording so that we can have this for other students who want to log into it later. And then on the call, just to let you know who we've got on the call that can take questions. And then I know that there's some others. I know I'm not going to get all of the staff people that are on, but just those that we had really asked to be available to ask questions would be Dr. Grant Hokett is on. Judy Hay, the Dean of Students, is on. Lori Peterson, the Vice President of Administration, is on. Vice President of Instruction, Kathy Day, is on. And Athletic Director, Charlie Gross, is on. Those folks have all been working either with or as part of the Marching Back team. So there's some opportunity for you to actually get some of your questions answered. As I'm moderating, one of the things that the staff members could do for me that would be helpful is if you want in to answer a particular question that I ask or you see in the chat, if you would let me know in the chat, that would be good, because I know we have a couple other staff members on that may have expertise in an area or something to add, and I want to make sure that we get you in here. So with that, Dr. Cech, we'll go ahead and let you take it away for opening comments, please.
Thank you, Dr. Hazelbaker, and welcome. This is a great turnout for a Monday afternoon, and I just want to thank you for being here, and I also want to just take this opportunity to thank you for all you're doing. These are obviously challenging times, not only here but across the country and frankly across the world. And I'm very proud of what we're doing here at Carroll College and the proactive nature that we are placing on this and taking. I think it's making a difference, and it is definitely a group effort. For many students and many of you, face-to-face learning is a critical part of why you're here. And I just want to assure you that as an administration, we are committed to that. And we've been committed to that from the beginning of the semester, and I'm committed to it through the end of the semester and for the startup of school and next semester. This pandemic, this virus is going to be a part of our lives. We don't know for how long, but it's probably going to be a part of our lives for the next several months until a vaccine is available and widely distributed. So, you know, since it's a part of our lives, we just need to be able to continue to adjust and improve both our plans for this fall and for spring semester. And I have great confidence that we're going to be able to do that. We've heard a lot about the challenges of being in isolation and quarantine, which is why we've bolstered our efforts by forming the COVID-19 Active Case Action Team, which Charlie Gross, and Charlie is out there today. Charlie is leading that, working with Judy Hay, our interim Dean of Students, and several other people to support the students in isolation and quarantine. And I do want to say I'm just so impressed with how well our students who are in isolation, those who have tested positive, and those in quarantine are doing. On Saturday morning, I took about 3.5 hours and I called every single person who's been tested positive with COVID-19. And I reached about 75% of them. I think we have some of them on today. I see them out there, and had a good chat with them. And I'm going to try and make time this week to reach out to those who are in quarantine as well, just to touch base and see if there's anything we can do to make your stay more comfortable, if you have any concerns, and just to hear what you have to say. And I'll have more to report on that in just a second. We're continuing to make tests available, and we've seen the number of positive students diminish, which is great news from Friday through Saturday. And unfortunately, the tests that were due to be released on Sunday made a side trip through Nashville for whatever reason to get to Boulder, Colorado, but we should be getting those today. But so far, the early trends have been that we've seen a major dip in the numbers of positives and the percentages of positive, which I think speaks very, very well. We all know that it's going to take everyone doing their part. Masks and social distancing do make a difference. Going back to the in-class teaching, you're probably safer. In fact, a health official made this statement in a Zoom call last Thursday. You're probably safer in your classroom than you are any other place on campus due to the protocols and the procedures that are in place. And also remember that one party or large social gathering can have a tremendously negative impact. So please make the right decisions and say no to invitations to parties and large social gatherings. And I'll just give you an example. In my personal family, my three brothers and I have a tradition, especially since my mom and dad died, of getting all the families together for Thanksgiving and having it at a different home each year, which means, 30, 40 people for dinner. And we've decided this year we're just going to have our own family dinners out of safety. So the Cech family Thanksgiving dinner is going to be pretty intimate, about 3 people this year. But it's what you have to do during the time of a pandemic. As I mentioned, I did talk with. I called our students who are positive with COVID-19, and as I said, I talked to about 75% of them, and I just kind of kept track of what I was learning from the calls. For those of you who received one of my calls on Saturday, we talked about this, but I just thought I would share with you about what I learned. I thought it was kind of really interesting. Basically, about 50% of the positives had some upper mild to moderate symptoms, and things like fever, sore throat, headache, upper respiratory, body aches. They definitely felt sick for 2 to 7 days. And the good news is, I think the vast majority, if not all, felt better, much better within a week. And none felt like they needed outside medication. But still, it does hit you hard, and this is not a bug that you want to get by any sense. About 35% experienced mild symptoms, similar to what I just mentioned, but less so. Interesting to me was about 60% lost taste and smell for at least a day, some longer. And then about 15% of those I talked to had no symptoms. So the good news was that the spirits seemed really high on with everybody I talked to. So just wanted to pass that along to you. We all need to support each other during this time and provide the grace that is a part of our Catholic tradition and who we are as a Catholic college. We're saints. And everyone we know is under stress from COVID and the challenges associated with our coursework at this time of year. And this, I also want to take this opportunity to give a shout out and a thank you to our faculty I know are working really hard with the students, and our staff who are working double time to to support the students and doing everything from keeping this place functioning to making sure that food and care packages and all of those sorts of things are delivered to the students. But I'd like to ask you to help me by supporting each other and the faculty and staff who are working to turn this tide and to support each of you. We're working hard to be as transparent as possible, and if you have questions, you hear rumors or have feedback, email covid19@carroll.edu. That's covid19@carroll.edu, and we'll get back to you as soon as possible. And if you send your questions, we'll also find out what to include in the emails when we do reply. Something else I do want to say is that just from my investigation around the state, we are, I think we're the only college and university in the state that is engaging in as aggressive asymptomatic testing as we're doing. And we're doing that because we want to keep all of you safe. We want to be proactive. And, you know, that's resulted in our numbers probably being higher than they would have been if we had chosen not to engage in asymptomatic testing. But it's the right thing to do. And I think it's the Carroll way of doing things. So I couldn't be more proud of all of you, and I couldn't be more proud of our faculty and staff who are supporting you. So I'm going to turn it back over to Dr. Hazelbaker, and I do believe there will be time for Q&A a little bit later.
All right, so Shae, why don't you take it away, please?
Yeah, thank you all for being here. I just want to say, you know, a lot of the decisions that are being made are because of you guys and your opinions and your student voices. So I just encourage you all to ask some good questions here and make sure your voices are being heard. That's what really matters is you guys. So just another reminder, I know it's hard to be grateful when things aren't looking good, but just remember to say thanks to the administrators who are working hard for you guys. And I know it's hard, but we'll just keep fighting, be patient, persevere through this, and we'll make it out okay. So, and for those of you who are interested in serving, finding ways to help out the campus right now, I'm looking for more people to help deliver meals, especially on the weekends. And then I know Jennifer Bingham is also looking for people to help deliver meals during the week. So contact me, contact her. We really need you guys to step up and help serve the students who need food. So it's a really important thing that we have to do. So again, thank you guys for showing up for this. It means a lot.
Thanks, Shae. And Eric Rose, would you please just give us an update on where we're at with testing currently?
Of course, as you all know, we are conducting asymptomatic testing both at the Wellness Center and at the PE Center. The Wellness Center hours are from 9 to noon and then 1 to 4 on Mondays and Tuesdays. And then the PE Center is noon to 2 as well on Monday and Tuesdays. And those hours may shift during the course of the semester, depending on what the student interest is and what the Wellness Center workload is. So we'll continue testing through finals week. And for those of you who are still on campus, we're evaluating some testing into December for people who are still in Helena. The test results usually get turned around within 48 hours. So we collect the tests at the end of each day. We have to ship them down to Denver. And then it takes our lab about 24 hours to produce a result. Those of you who were tested on Friday, we still don't have your results yet, as FedEx has shipped those and they didn't make it to Denver until this morning. The lab every once in a while has tests that come back and they need to be rerun. So it's not uncommon to receive a result that says pending rerun. So a few of those who were tested, especially on Monday, received a pending rerun result. So if you get one of those, hold tight and wait another day or two for your actual result to come in.
Great, thank you, Eric. So the chat window is open for any particular questions that you have now, and I can help direct those into the proper place as they come in.
And Chado, I think Charlie Gross was also prepared to say a couple things.
Oh, sorry, I did. Charlie, if you want to take it away, that's great.
Thank you, Dr. Cech and Dr. Hazelbaker. So the COVID-19 active case action team gets together in the latter part of the afternoon at around 4 p.m. And that is the time when we review what's happened on campus to determine, are there new active cases? Are there new quarantine cases? And this is the group that starts out by working on the logistics behind the scene to determine how many people need to move, where they need to move to, where do we have rooms for isolation, where do we have rooms for quarantine, how do we coordinate the feeding of the individuals, the communication with the individuals, transporting them, and then trying to somewhat accommodate the care of them while you're in quarantine or isolation. So this group has been meeting daily since last Wednesday and will continue to do so, and is trying to respond as quickly as possible to the needs and the concerns which develop as you arise when you're in isolation and quarantine.
Great. So we have a few questions, and I'm going to take a couple of them just because I'm also sitting on the marching back team. So we don't release sort of hard numbers. So what I can tell you that we publicly release, these numbers change all the time. So there's a question about how many people are in quarantine. So it's approximately 150, but that number changes on an almost hourly basis. So that is something that we will be, that we don't update in general. Working through a couple other questions, and then why only testing on Mondays and Tuesdays? We will continue to evaluate based on testing demand. So last week we expanded our testing and went to 5 days. We're currently looking for an additional nurse to help us do additional testing. And so we will continue to look at expanding testing as there is demand. There's a question here about, given the high amount of cases, did you consider going online for 2 weeks to curb the spread? I guess I would go back to Dr. Cech's initial answer on that, and that's that yes, we did consider that. But on Monday afternoon of that first outbreak, we did speak with public health. And then we did also speak with the faculty on campus. Public health did not have any evidence of viral spread in the classroom. And they did feel like the mitigation efforts in the classroom were good, which is actually consistent with what people are finding nationally. The other thing is that many faculty did feel that we wanted to be strategic in what courses we did put remotely to make sure that we slowed the spread, but then we also had the ability to, make sure that over time, students could get the face-to-face clinicals and other lab works in. So a couple other questions coming your way. There are a lot of questions here, so I'm going to start going to some other people. There's a question about, are students going to have the option to learn remotely for the remainder of the semester? That's a very case-by-case basis, depending on the individual student, and the individual should email advising@carroll.edu. So there's just many questions here about the idea of if students can go online. So one student wanted to know why we're not giving the option to go fully online then longer than 2 weeks if we feel unsafe because it is a concern or personal health. So do I have maybe a faculty member or somebody that wants to talk a little bit about the in-campus environment and the importance of that, and just really what we're trying to do in the classroom and then remote instruction?
I guess
go ahead, Grant. Thanks.
I'm trying to answer that, Chado. So from a faculty perspective, and we want to keep our students as safe as possible. Each faculty approaches their courses a little bit different depending upon the nature of the instruction required. So for purely lecture hour oriented courses, it isn't as challenging to go online, even though we feel that it's always better, education is always better in a face-to-face environment. On the other hand, there are some situations like in laboratories or in practical situations where it's nearly impossible to replicate the same educational experience online that you have face-to-face working in the laboratory or with the anthrozo students directly with their animals, or with the nursing students in the simulation labs. So what we've tried to do in those situations is design those experiences so they're as safe as possible, so that the risk of transmission is quite low. And as you heard Dr. Cech say at the beginning of this presentation, our county health officials are emphasizing that the classroom and laboratory is one of the safer places to be on campus. So as long as faculty members are following and implementing the social distancing, mask wearing, hygiene protocols that we've called for them to do, you should be very safe in laboratory or practical situations. That being said, I know personally in my courses, in the lecture portions, I allow students to choose. So I'm running a hybrid environment where students can either Zoom into class or show up face to face, and it's up to them to decide in that situation. So
And Kathy, sorry, Grant. Thank you very much, Dr. Hope. Kathy, did you want to add anything to that?
Yeah, I just wanted to thank you, Dr. Hogan. That's really important from the faculty perspective. We're trying very hard to continue to deliver that special in-person academic experience for all of you, whether it's remote or in the classroom. Some of you really want to be in the classroom. There are other students who don't feel safe. There are faculty who are in the same situation. Some are teaching fully remote, and others are in the classroom and would rather engage in the classroom. We're trying to deal with students on a case-by-case basis, have tried to get the appropriate technology, but I think it's important to know that not every faculty member, because of their style of teaching and the pedagogy they use in their class, is as adept at teaching in two different environments, which is the face-to-face and the online. So we're not encouraging our students to go home. We hope to flatten this curve to be able to open our classes back up fully for those of you who are here. But if you find yourself in that situation, please reach out to the folks in the St. Success Center, and they can work with you individually.
And that is advising@carroll.edu. So advising@carroll.edu is where you reach out to talk about your individual class. And I think Kathy makes a great point is in a lot of ways, this is the hallmark of the Carroll education, is this one-on-one attention, and advising@carroll.edu is doing the heavy lifting on that to work with faculty and others. So I'd encourage any students to reach out on that. So I'm Judy, Hay, or Emily, I'm actually coming to you with a question that I'm going to start answering, but is there anything being talked about to prevent outbreaks from happening on Halloween? It seems that we're hoping to be out of this on the 28th, and we could be right back after the 31st. We are actually starting a number of things now to talk about how to do education and some programming around Halloween, because we share a similar concern. We understand that that date's really important, and I think the key is that you can probably do the best job for us, and just spreading the word is that the worst time to be in quarantine or isolation is going to be right at finals week. So making sure that we have good processes on October 31st. But Emily or Judy, do you want to address anything else that we're talking about in terms of to try to prevent further spread around the Halloween holiday?
Yeah, thanks, Chado. This is Emily Busby. I just wanted to, again, thank you guys for all of your cooperation and help in this. That's really the key when it comes to Halloween. We're going to be doing increased rounds and supervision in the buildings, in the residence halls. We'll be offering reverse trick-or-treating and some small programming within the halls, just to have something festive to do. But it's really important to understand you know, a lot of what we're seeing is the result of students going off campus. So at this time, our common areas, the lounges are offline. And so we can get through this major uptick that we're seeing in the asymptomatic testing. Hopefully we can open those back up for some small activities to do together. But we're going to be sending out an email with some alternative ideas for Halloween. Halloween movie night with you and maybe, you know, 1 or 2 other friends, taking some time to maybe explore some of the other opportunities in Montana, like visiting one of our mini ghost towns, you know, trying to find some opportunities for you guys and ideas for you guys to commit to, but we can't make you do it. So if we're going to give, you know, give ideas and things, you know, it's up to you guys, like Dr. Cech said at the beginning of this conversation, to say, no, thanks for the invitation, but I'm not going to go to a house party on Halloween. That's really going to be key in making sure that we can do finals and move you guys out of the residence halls successfully 2 weeks after Halloween.
Great, thanks, Emily. There's a question here about have we considered a student survey to gauge what students want for their education? And I assume part of that is remote versus in person. I think it's a good idea for us to do some additional surveying of students. And so we will capture that idea. I'm going to save the chat and just make sure that and find out maybe around next term. There are some, there are some complications with that, which I think Dr. Hokett and Kathy Day spoke really pretty well about it, just in terms of everybody's preference. There's their preference of how they'd like to learn, but then there's also the reality of what programs require in terms of face-to-face experiences. So a question about why we're not doing widespread testing of requiring testing for all students. So what we're trying to do is we're trying right now to allow testing for all students, but not requiring it of all students, other than that there were groups of students in high contact areas that were required to be testing. That seems like the best strategy right now, but that is a strategy that we'll be continue to talk about, is what widespread testing might look like. So we do have the capacity to do plenty of testing. We haven't currently decided to go to required testing of all students. There are some legal challenges with that in terms of what we can require. But that is something that is on the table that we continue to talk about as we look at the rates. There's a question here about, yeah, go ahead.
Yeah, I just want to reiterate, anybody who wants a test is going to get a test and free of charge. So we've got that available, and I just want to make sure that everybody knows that and spread the word.
Great. There's a question here about why we're only doing asymptomatic testing on campus. It's just simply not safe to do symptomatic testing on campus. So the bottom line is that we're able to do asymptomatic testing because most of those students, right now about 92% of them that get asymptomatic tested won't be positive, but it's not possible for us to do symptomatic testing, partially because of the laboratory space that is needed and the type of test and the training that's needed for people to do it. So we're not able to do symptomatic testing on campus because we're not able to do the deep nasal swab, which is what it's called. I do want to reiterate that by calling the Wellness Center, Carrie Rigsby can go ahead and get that test ordered for you. And we do work with St. Peter's Health and have been working with them all along to make sure that we can get you tested if you are symptomatic. So we just can't do it on campus, but we can make sure that you get that test. What would constitute an on-campus closure similar to what happened last March? The best answer on this one is that actually is a public health decision. And so we would work closely with public health, but there are a lot of things that are different than last March in terms of what we know about the disease. So questions are coming in pretty fast right now, so we're going to try to work through these pretty quickly.
Shadow?
Yeah.
If I could jump in on one too. Last March, let me just give you just a recap of how it developed for us last March. On March 1, I convened a full cabinet meeting with members of public health.
When Kathy gets here.
Oh,
Yes.
if you want to mute your mic, that would be good. Thank you. But last year on March 1, I convened a full cabinet meeting with a couple of members of public health and preparedness to talk about the coronavirus, because it was just starting to get on our radar screen, having just surfaced a couple of days prior in Seattle. 17 days later, we moved to 100% remote. That's how fast it moved. So the difference between then and now is that we've had 6 months to get ready for where we are right now, from procedures and protocols, the marching back plan, to spacing in classrooms, masks, technology, you name it. So it's really not apples to apples. We are so much better prepared to deal with it, and we know, as Grant Hokett would say, we know so much more about what we're dealing with than we did last March as well. So I just wanted to provide that background. Shadow, back to you.
Great, thanks. We have about 12 questions stacked up here. So one of the things that I do want to let you know is we will be ending at 2 o'clock, but I will be saving the chat, and via email we'll get out any additional questions. So there's a question about people in state being able to quarantine versus out of state. That's actually a public health decision. So Lewis and Clark Public Health is actually who tells us they actually would prefer that all students, so let me just repeat this very clearly. Lewis and Clark Health would prefer that all students quarantine in the Carroll College facilities. They would prefer that all students not leave campus. However, in some cases, students that have been contacted by public health can work with their public health officer, and if they can travel home safely, have been allowed to do so. But that's a conversation with public health. That's not a conversation with, so we're facilitating that, but that's a conversation with Lewis Clark Public Health. So it would be our intention to make sure that we provide those isolation and quarantine spaces because of that. So a nice note here about thanking nursing students for the decisions that have been made. And then there's a long statement here that everybody can read about students not being able to trust each other's. So why isn't Carroll doing regulatory mandatory testing for all students? Well, again, we'll take that feedback and we'll take that into the group right now. I think right now, we're only a week into this testing that we've done across the widespread. And I think that there's a good point here about not being able to trust each other, but frankly, as a community, that's what we have to do right now, is we have to work together to be able to get this. So we actually, I think, do have a really good testing regimen in place, and our lab has been very successful. So appreciate the link about the diagnostic testing that can be done out of Missoula, but we do have that good now. So, a question here about having an epidemiological curve on our website to follow. We're working on some additional reporting. One of the things we'll be talking about in spring is how we can increase that reporting and putting some of our testing data on the website. But we're working on that now. How are you holding students in isolation accountable? Again, there's a lot of questions here, I think, about people's accountability, both in testing and so we're doing our best to supervise students, but public health is ultimately who is in charge of those health orders. And so they're actually the ones that are largely holding our students accountable. Judy or Emily, do you have anything else to add on how we're holding students in isolation and quarantine accountable? What are some of the other tools in our toolkit?
Well, we don't have the capacity. Our staff, as you might understand, with the numbers we've been dealing with, and some of them are RAs that have been identified as close contacts or have gotten the virus themselves, and so we are not as fully staffed as we normally are, and most of us are not doing our normal day jobs. And so when we have escorted people into isolation or quarantine, we expect them to honor that isolation and quarantine. And it's hard to hear that some of the students have not honored that. When I know about it, I contact that student and make it very clear that they need to continue to abide by their orders from the public health department. And so that's what I can do. I don't want to overpromise and say that we have someone outside every room watching them, because we just don't. And we do depend on the integrity of every single student to get through this. And so to the extent that they will and can, I think we're doing fairly well. It sounds like there may be a few cases that we have had a little over confidence in that, but I will be glad to follow up with anything if there's an issue. However, I don't want everybody to be watching everyone else and create a bit of a hysteria on campus, because one thing that Chado mentioned earlier that is a real reality here is that a person could be isolated because of the testing positive, and then out of their isolation by order of the health department before you maybe think they should be, but you don't really know what the details of their case is. And so I would say you may or may not know what the full story is when you see people back out on campus, because some people are being released now. I've probably had a good half dozen to 10 students released now, and that will increase this week because people will have been isolated or quarantined for the length of time that the public health department said that they need to. So don't always assume that someone coming out of a room means they're still contagious or should still be quarantined. We just don't know. I mean, you don't know. I do, because I've got all those records. But I hope that makes some sense.
Charlie, maybe you can help me with this next one. So the question is, what are you doing to keep people in quarantine isolation from doing laundry in public areas, etc.? And I think Judy kind of answered that just now about how we're, meeting there. But how is the team that you're in charge of helping students meet those basic needs and keeping in touch with them so that they don't have to necessarily get out and do those things?
Well, we talked about it before they went into quarantine, to let them know that those that we actually had to move locations, that they would not be able to access their local laundry, and that we advised them to pack accordingly as quickly as they could, as well as if there are needs, you would have to, if you're in a hotel, wash your clothes in your sink. It's not ideal, but it's the situation that we're in. We are currently delivering packages to people. If people are having packages delivered from home, we are delivering them so they get those. So if students have asked for supplies in certain situations, but there's no beating around the bush. It's a very, very difficult situation to be in when you're quarantined to a room and you're not supposed to leave that space to keep those around you safe and to make sure you're staying safe. Laundry accommodations have not been offered to our students that are in quarantine and isolation.
There's a question here about what evidence do we have that proves the virus is not being passed during classes and other what the health department has advised. First of all, I'd point you to the national data that continues to come out, a study out of New York today that points to this. The other thing that I would just point out is our evidence on campus is that even with the numbers of positives that we've seen on campus, is we don't have any evidence yet, or the public health, of faculty and staff positives from contact on campus. So despite the number that we released on Friday was 70 active cases on campus. And at that time, we had one part-time person that was COVID positive, and that person did contact COVID off campus. We currently are waiting a couple of other test results on employees that have been tested. But again, they've been tested largely by due to off-campus contact. We don't have any on-campus contact in that. So Judy or Emily, if you could help me with this one. So can you talk about safety in the residence halls? Because it is scary being here with people who have been contact traced and also having designated bathrooms with the people who could possibly be infectious walking down the hallway.
I was unmuting myself, so hopefully I caught all of that. It sounded like the question was, what are we doing in the residence halls with the first contacts, but maybe I missed something.
Yeah, I think generally about how are we handling safety in the hallway? And then I think there's just a question also there's about, how do we handle students that just might be afraid?
Yeah, totally. So I'm glad that someone asked about the first contact bathrooms, because I'd like to give a little bit of context here. We made the decision on Friday and sent an email out Friday evening, giving people a heads up. We opted to use vacant spaces and or leave students from this point on in their current room, if at all possible, who are only first contacts. Many of the first contacts have a negative test, not all of them, but many of them do. If a first contact becomes positive, they will be removed from the general residence hall areas into our isolation areas for the positive tests. All of the first contacts that have been that are in Guad and St. Charles have been given very, very strict instructions. They've also been provided disinfectant. They're to use their designated bathroom only and then return to their room. All of their meals are being delivered to them. And the alternative to this, which we were in a position in the spring that we needed to do this, we emptied an entire building in the spring and had to move healthy or otherwise unaffected students into other locations for the rest of the year. And so as an alternative, I really wanted to use all of our vacant spaces before we made students, healthy students, or students who are otherwise unaffected by this COVID surge right now. So that's why we made that decision, to make sure that we were moving the least amount of students as possible, especially those who are not first contact or positive. So in addition to that, there's been, we're working on an increased round schedule. I did rounds in Guad on Friday. There seem to be some students who take this really seriously and have done a nice job thinking of their peers and their community members. And then there again, and there are some students who seem to not be as thoughtful about these COVID restrictions. And I would really impress upon every student that's living on campus, please make sure that you're doing your best to keep yourself healthy and safe. You need to be wearing your masks in the hallways at all times, washing your hands, using your own disinfectant and the disinfectant that's provided in the common spaces and the hallways, just to make sure that you're keeping yourself safe. If everybody is following the CDC guidelines, there should not be an issue, and there should be a very, very, very low to none transmission between those first contacts. So please encourage, peers on that floor to be washing hands, wearing masks, taking care of themselves, getting enough sleep, getting enough water, so that we can all be safe in this situation.
And so I'm going to go on to thank you, Emily. So I'm going to go on to the next question. I may need some clarification on this one. So you may want to email covid19@carroll.edu. And Eric Rose, I'm going to come to you with just testing capacity. But a question here is, students have been turned away for wanting to get tested twice in a week due to being exposed, but were turned away. So Eric, if you could just address if we have capacity and if we're running out of tests during a day. I wasn't aware that that was happening. I thought that we were able to get everybody tested, but the second part of the question is, will this continue to happen, or will students be able to test however often that they would like? We should have ample testing capacity now that, again, we have talked about not going to require on-campus testing for all students, but in terms of having tests available for everybody that shows up during those open testing times, we should have tests available. But if there's something else that's underlying this, you can certainly send me a personal note to covid19@carroll.edu. But Eric, where are we at with just testing capacity?
So to my knowledge, we aren't running up against any barriers with testing technology or testing capacity. I wasn't aware that any students had been turned away from testing twice a week. Given the week that we had last week, where we had testing at the beginning and at the end of the week, I can see how it would have been appropriate for students to get tested more than once if they were notified of being a contact. As we move to, I guess, fewer days of testing for the next couple weeks as we evaluate the testing, the interest in testing. I'm not sure if getting tested once on Monday and once on Tuesday is going to yield any benefit. But to my knowledge, we don't have any capacity limits on testing, and our instructions haven't been that you can only test once a week.
Great. And there's a question here about if students are wanting to get tested on the weekend but don't have access to the wellness center or a primary care facility for referral for testing at urgent care, do they have to wait another testing option, or do they have to wait until Monday? And the answer is no. You can actually call urgent care on the Marching Back website. That number is listed. They do have hours over the weekend. You can call the urgent care and they will attempt to get you in. But I would tell you what the better thing to do is to go ahead and get a hold of Carrie Rigsby on a Friday or Thursday or Friday before she is off for the weekend, and ask her if she can put in that order for you potentially over the weekend. But I would really ask you to, coordinate with Carrie Rigsby if you know you're going to need testing over the weekend. If you don't know you need testing over the weekend, that likely means that on the weekend you're symptomatic, and then you should call urgent care, let them know that you're a close contact or symptomatic, and urgent care can go ahead and order that test, and then you can show up and do the drive-through testing at St. Peter's. You can also go to Pureview Clinic, or you can go to, Walgreens. Those tests have been taking a little bit longer in some cases, but all of those are weekend testing options, and that's been sent via email and is on the Marching Back website. So there's a question about many of us work in the healthcare field outside of Carroll and would be considered high contact because of our jobs. Are you worried about community spread coming into the campus? And are these people required to test regularly? So there are high contact populations that we are going to require to be testing regularly, and we're still working out exactly what those high populations are. But particularly in areas like nursing, there has been a pretty aggressive effort, and then the clinics and the hospitals themselves also have their efforts, and we've been working pretty hand in glove with them to make sure that in the healthcare field we have a really smooth relationship in how testing is taking place. A good question about what should we do if we suspect our quarantining neighbors are not really quarantining? So I'm guessing, so Judy, I'm going to come to you with the real answer. I'm suspecting you would prefer they just email that to the COVID-19@carroll.edu for forwarding to the right folks, or would you prefer something else on that?
Yeah, you could, the COVID-19 is a good place to send it. That's not a bad idea.
Great, thanks.
And I would say, and that email goes to a very few people, just so that you all understand. And so we would have to have a name or a room number. Well, both would be helpful, because otherwise there's just little I can do when we've got 170 students that we're looking at.
Great. And then Judy, I may have to come back to you with clarification on this one, but the question is, will Carroll hold their students accountable for the risky behaviors they've been participating in, examples, attending house parties and free concerts, etc.? I do want to just note that we appear to have a few parents or public people from the public on the call. And so I don't know everybody that clicked on the Zoom link, that's just fine, but I want to make sure that we're not getting students in here as well. But for students, there is a code of conduct. And as part of that code of conduct, do you want to just follow up, Judy, on any of the things that might be on the table there?
Sure. I think right now we can all agree that that having a house party, and especially having people over to a small house and in a small room without masks, is an irresponsible thing to do in this outbreak that we're having both on campus, but in our county too. Our county is on fire because of a few things that have happened. And so we're part of that, and part of the problem when we say we're part of that. And so we want to make sure that people are being responsible with themselves and with others. So a house party is a bad idea when we know about it. And what I can say is I don't have the capacity, I don't know that we have the capacity to go around and patrol every address of an off-campus student. But if we get reports, we will likely be able to follow up and hold people accountable through the conduct code.
Great, thanks. Charlie, I'm going to come to Dr. Cech. I'm going to you with a question, because you wanted in here, and then Charlie, I'm going to a question with you just about what precautions are we taking in athletics. And then I do want to just let everybody know that we have about 9 minutes left. I'm going to get through as many of these questions as I possibly can. But if by 2 o'clock we're not through all the questions, we'll go ahead and we will go ahead and save the chat and we'll respond to them via email. So Dr. Cech, was there something that you wanted to get in here quickly?
Thanks, Dr. Hazelbaker. Just 3 points I wanted to make sure and make before we run out of time. First of all, I just want to reiterate that this conversation that we're having today as an extended family is a type of conversation that should be happening on every college campus in the country right now. I can guarantee you it's not. And I feel very fortunate and honored that it's happening here because we are being proactive, we are providing testing, and we're doing what it takes to keep everybody safe. So I just want to reiterate that. The second thing is if somebody can't get a test, just send a note to the COVID-19 site or send one to me. You all know how to reach me, president@carroll.edu, because we want to know and we want to make sure if there's a holdup that we get that taken care of. And then the third thing that I haven't heard mentioned today is get a flu shot. Because you know the flu that's out there is every bit as big a risk as COVID-19, and we have flu shots available. Be sure and get it. It's super important. I got mine, so get that done. Back to you, Dr. Hazelbaker.
And Charlie, in the private chat, I've just had a couple of questions about what's happening in athletics currently. So if you could just talk a little bit about your precautions, that would be good.
So last week, we suspended practices for athletic teams and closed the use of the PE center at the same time the Hunthausen Activity Center was closed. Currently, our cross-country team is in mid-season with meets that are scheduled in a conference championship. Our cross-country team late last week practiced outside as far as running individually, not as a team. This week we are opening up the PE center to use on a one-on-one individual basis in the gymnasium for basketball as that season has begun. But it's only individual workouts, and there is no formal team practice going on at all, and that will be determined as we move on, as we progress through the end of the week into the following week. There are no other sports that begin prior to the second semester after the new year, except for the sport of basketball. So things will be quiet in the PE center as we continue to move forward. We will still, when we do open the PE center back up, we will continue our check-in status that all student athletes have to check in, and they've been doing that online with the app and doing symptomatic checking.
Great, thank you. And then we're going to try to go really fast here to get everybody in. So how many cases do we have right now? My current, the closest number I can give you is between 70 and 75 active. So the number on Friday was 70, and that number is somewhere between 72 and 75. But again, because of the way that the tests come in, and then that's actually, I think, probably a little high on the active because some of those actives have actually come off the active list, but we don't actually get students off the active list as soon as possible. So somewhere between 2 and 5 new cases probably since we were published the result Thursday at 5 o'clock. But again, we just can't give you a more accurate number on a day-to-day basis because of the time lag. I do have a couple of private notes here that I saved the chat. I will be working with the individual person in charge of that department or area to make sure that they get the feedback. So I want to make sure that I let those people know that. Emily, I want to specifically call out that we will follow up on the weekend testing because it sounds like I had said that peer review was closed over the weekend and that we weren't able to get urgent care testing on Saturday, which is different than we were told earlier in the week by the physician that we're working with at St. Pete's. So we will follow up on that particular things. Another sort of piece of support for the student survey. And so we can do that. And then coming to you, Judy or Emily, with a question. So on the topic of first contact bathrooms, about how long will this be happening and when can we expect to use our original bathrooms again? Are the first contacts just waiting to be tested or waiting for testing?
Actually, when you're a contact, you are quarantined for 14 days after your last contact with that person that was positive. And so their testing will not necessarily impact the time that they're quarantined. And so what I would say is expect that this situation will last until we are able to get a real handle on this. So again, it depends on the students and how their behavior continues to either contribute to flattening our curve or not. And so the sooner that we can just get people quarantined, isolated, whatever it is they need, and they stick to it, the longer or the quicker we will be out of this kind of crisis mode that we're in. So if everybody cooperates, I think it could probably be within 2 weeks easily that we would have that space back.
Great. All right. So Dr. Cech, anything final?
Absolutely. I just want to thank you for your questions. These are great questions, and thanks for taking time on your Monday afternoon to being here. And, you know, I just want to leave you with a positive thought. The early indications are that we got on this, we got on it fast, thanks to our fantastic team, and by the reduction of the positivity level, you know, I think we caught this, and you know, I think we're seeing a flattening, and we'll ultimately see a significant decrease in the curve. As I talked to a couple of presidents who were in a very similar boat, Benedictine College and Adrian College last week, we're doing exactly what they did, and they commented that the numbers will go down as quickly as they came up. Both of them said that. So, and that's thanks to the due diligence and hard work of all of you, the students, and the faculty and staff. So thank you, and thank you, Dr. Hazelbaker. You're the best Zoom moderator I think I've ever seen. You've got a lot of practice. So
all right. Well, I'd like to not do this job, and the Zoom moderator job. I'll be happy when it goes away. So, folks,
exactly. Thanks.
Folks, I'll make sure that I save the chat, send it off to the appropriate people. But it looks like we're already losing lots of people that are probably on their way to 2 o'clock classes. So, with that, I will just say thank you to everybody that was able to participate. You can start to log out, but I'll stay and save chat over the next few minutes in case you should have anything else you want us to follow up with via email. Thank you.